Good afternoon, everyone, and welcome to our scientific meeting. I am Dr. Ganapola, and I want to present our program for today. Our topic today is Diabetes Nursing, National and Global Perspectives, which we organized within the framework of scientific activities of Nearest University Faculty of Nursing. Firstly, I would like to invite Assistant Professor Dr. Serap Tekbaş for the speech.
Welcome, dear Professor Dr. Shaida Osjan. We would like to thank you for improving of nursing discipline. It's glad to see you with us today. We are so excited to your speech. Thank you. Professor
Thank you for
Dr.
the speech,
Shaida
Doctor.
Osjan.
Thank you, Serap Hoca. I would like to invite the speaker of the conference, Associate Professor Dr. Shaida Osjan. The topic is Diabetes Nursing, National and Global Perspectives. Before giving the stage to the speaker, I would like to give the briefly information about the Dr. Özcan. Dr. Özcan graduated from the Florence Nightingale School of Nursing of Istanbul University, and they completed her master and the PhD degree there. She is currently working in the Koç University School of Nursing for the 7 years. She worked as a chief nursing officer in 3 leading hospitals of the Webby Koç Foundation. Dr. Özcan has been member of the fund since 1999 and served as the executive committee member and the special advisor of fund. She was the member of the Europe representative of the Diabetes Education Consultative Section and the General Secretary of the Turkish Diabetes Nursing Association, member of the Board of Trustees of the Turkish Diabetes Foundation. Dr. Özcan is author of a lot of published articles, books, and national and international research projects and the clinical experiences in Turkey, US, Europe, and China. She has been rewarded with the several scientific and the service awards. Dr. Özcan has been recently awarded with the 2 significant nursing awards. European Diabetes Nursing Recognition Award was given by the Foundation of European Nurses in the Diabetes for her to make a very significant, distinguished contribution to the diabetes care, research, and education in the specialty of the diabetes. This prestigious and honorable award have been given to the key nurses in the global effects in the diabetes fields. Her name has been placed within the award list of the International Diabetes Nursing. Professor Dr. Pelihan Velioğlu Nursing the Honor Award, which is a national prestigious nursing award, was given to her national and the international contribution to the nursing. So we are really welcome our Professor Dr. Şeyda Osjan. Professor, you are welcome.
Good afternoon. Thank you for this great, nice introduction. Thank you very much. And thank you for inviting me to this meeting. I have great honor to be with you and to talk this subject to mainly to your students and to everyone actually who is interested in the topic. And dear participants, dear organizers, I would like to express the topic in the light of World Diabetes Day theme, because we are in the week of World Diabetes awareness. So this is very specific time, very important time for us. 14th of November is World Diabetes Day, and this week also is a week which when we have opportunity to increase the awareness in public about diabetes. So this is very meaningful time for me. So I am very grateful to talk within this week in your area, in your broadcast. I would like to share my slides now.
Thank you, Professor.
Thank you very much. And actually, I did a little bit revised the title, Diabetes Nursing and My Journey in National and Global Perspective. I would like to express the topic. And I am planning within 4 sections. So in the beginning, very brief overview of diabetes. Then I would like to give some brief information about diabetes nursing. Then some experiences to express the national and international global activities in diabetes nursing. So I would like to finalize my talk with some key messages. And diabetes affect all people in all ages, all genders, races may be affected by diabetes. So it's very common health problem for everyone, for everywhere. And this is new number. Actually, International Diabetes Federation just published new Atlas, Diabetes Atlas. And just a few ago, they announced these numbers, and they will announce whole report in the next weeks. So very new numbers we see, and in the previous diabetes atlas, it was reported that 1 in 11 adults are living with diabetes. But now we see, after 2 years from the report, previous report, 1 in 10 adults are living with diabetes. So prevalence again increased, unfortunately. And there was 463 million people in the previous atlas. Now, IDF has recently announced there are 537 million people living with diabetes. So this is really huge number. That's why we are calling diabetes as a pandemic disease. We are very familiar with this term before coronavirus. So before COVID-19, we were using very frequently the term of pandemic, because diabetes is a chronic, although it is chronic disease, it is really affecting the people, the world, like a pandemic disease. So 4 in 5 adults with diabetes living in low and middle income countries. This is another important realities about fighting against diabetes. And 6.7 million deaths occurred due to diabetes in this year. So these numbers are showing us how diabetes is an important problem and why we have to solve this problem urgently. Also, there is another reality you see in the second line. Almost half are undiagnosed. This is another problem on prevention. These are the numbers regarding Turkey. There is no separate numbers actually for Northern Cyprus. That's why I didn't put the table, but you can find as general the numbers for Cyprus in the atlas. In Turkey, also around 9 or 10 million people living with diabetes. In Turkey, prevalence of diabetes is increasing. I have very much experiences in Cyprus too. We have some collaborations. We did some courses in Cyprus. A long time ago, I was there. I stayed for a week, for example, to teach nurses about diabetes. So we have continuous relations in Northern Cyprus. And I know diabetes problem is growing in Cyprus too. So this is a very similar situation between Turkey and Cyprus. We are dealing with a very similar problem. Obesity is increasing in Cyprus, and also type 2 diabetes related to obesity is increasing in people there too. You see some important numbers, but I don't prefer to spend long time by focusing on the numbers. But all lines, all information is showing us how diabetes is a pandemic problem. And this is about World Diabetes Day background. Long time ago, now around 15 years ago, an important achievement was stepped by International Diabetes Federation. In 1991, actually, 14th of November was accepted as World Diabetes Day, but in 2006, UN resolution on diabetes was announced. But in the behind of this declaration, there is a huge effort, lobbying effort, and after this hard work of scientists and volunteer people working for diabetes, this declaration was accepted by United Nations. Before this statement, before this resolution, United Nations didn't focus on a chronic disease. Within its agenda, usually acute diseases were placed. But with this declaration, UN also focused to a chronic disease, which is diabetes. So this is a really very important step, or almost milestone about diabetes. UN announced diabetes is a pandemic disease, and all government, all nations should fight against diabetes to prevent, to treat effectively. This is the document of UN resolution on diabetes. Also, with this acceptance, this blue circle was accepted as a symbol of World Diabetes Day. So after this date, we are putting these circles everywhere on our clothes, on our presentations. Everywhere you can see this circle. Also, there is another marking activity. For example, in the cities, in Istanbul, you can see some important buildings which are lightened up with blue color. For example, Galata Tower or Boğaziçi Bridge. You can see they are lightened up during 14th of November with blue color. So this is to increase the awareness in public and in scientific people, also in politics. It affected very much, actually. This resolution triggered very much that kind of activities. And why 14th of November, if you ask this? Because it is the birthday of Sir Frederick Banting, who co-discovered insulin along with Charles Best in 1922. So every year for World Diabetes Day, IDF announced a theme, and for this year till 2023, our theme is access to diabetes care. And this year we are asking to, especially to politicians, if not now, when? So we would like to get the answer from politicians by legislations, by regulations, to improve the access to diabetes care for all people affecting with diabetes. This is the theme for this year. And approximately 90% of people with diabetes has type 2 diabetes. But also we know that type 2 diabetes is preventable. This is very important side, very important opportunity actually for preventing a disease. If a disease is preventable, actually all health efforts should focus on this area. But we have a question mark. Can we do this for diabetes? How we can do this, how it can be preventable. You see some pictures here. I just got from this website. It was it was freely printed on website, and by stating its website address, I used here. And from the past, you have some pictures, possibly family pictures, and this is from United States. So very crowded area you see. Please check all three pictures. Do you see any people having obesity, at least having overweight? Actually, not. None of them has this problem. So how about now? So you see in this picture, now our look change very differently, especially in kids, even for animals. We are gaining weight, we are getting overweight or obese. So this is the main problem for diabetes, type 2 diabetes. So there are two important risk factors, unhealthy eating and also inactivity. So we have to change these two risk factors immediately if we want to prevent diabetes urgently. So how the management of diabetes? What can we do? Prevention is important, but also we have a very important reality. Around 537 million people with diabetes. So we have to treat, we have to spend some efforts for those people. So diabetes management is very important. You see in this picture the main components of diabetes care. Healthy lifestyle with increased activity, increased physical activity, and with healthy eating are two important steps in the beginning in the management of diabetes. But also there are medication opportunities. Oral medications or insulins could be used to be for using them effectively. Also, there is a very important factor for us, any very important very important chance for us or tool for us. It is diabetes education. So you see in this picture, when we talk about diabetes treatment, actually in the first line, we mention diabetes education, because when we educate the people with diabetes, they can manage their eating, they can manage their physical activity, and they can improve medication use or insulin use. So that's why diabetes education is very important in diabetes management. Also, for using these tools effectively, lifestyle adjustments are very important. After diagnosis, after diabetes diagnosis, people should change some lifestyles, and they can gain some new lifestyle habits possibly. So, is it easy? Please decide if it is easy. You see some examples. I'm sorry, I didn't translate. I forgot almost. I apologize for this. But maybe this is good not to increase your appetite in the afternoon. You see ice cream. One top of ice cream in the first line, and just four very small piece of chocolate, five tea sugar, and one and a half slice bread, or one glass of limonade. So these are giving 100 calories only. So we have to say no just to get only 100 calories. So usually I like chocolate. I can eat more than four pieces within a day if I have on my hands. So we in our daily life we are getting very easily many calories by eating some that kind of sweet things. So how we can spend 100 calories? You see here 30 minutes walking, 10 minutes biking, 11 minutes running, and 10 minutes swimming, and 8 minutes exercise also. So 30 minutes walking for four pieces of chocolate. So this is not easy actually. Many other behaviors should be changed in diabetes management if person wants to have better glucose management, better glucose results. So diabetes control should be achieved by lifestyle adjustments. In this picture, you see others, for example, glucose monitoring, measuring blood sugar at home, at work, convenient food care, sufficient sleeping, doctor appointments, regular health checks, and stress management, smoking cessation, physical activity, healthy foods, reduced alcohol intake, medication adherence, feeling check-in, and oral health also. So these habits should be improved if a person don't have enough regular activities on these habits. After giving this brief explanation about diabetes management and prevention of diabetes, I would like to talk about this year's topic, and IDF calls to action on four important steps for diabetes. This call on national governments to provide the best possible care for people living with diabetes, ensuring access to all the diabetes essential medicines, especially for insulin, and to develop policies to improve type 2 diabetes prevention, especially among young people, because type 2 diabetes is increasing in young group, in young ages, and to improve diabetes screening to ensure timely diagnosis and prevent diabetes-related complications. Also to create and implement mechanisms to engage people living with diabetes meaningfully. So these four action calls are announced to get some urgent solutions on these areas. This year and in the next 2 years till 2023. So our topic, our efforts will focus on these topics in many countries globally. So accessing to insulin is important within them. This year is important for insulin because insulin was discovered 100 years ago. So this is a very important anniversary of discovery of insulin. Millions of people with diabetes still cannot access the insulin, although they need. So this is a very important reality. Also in our country, in Turkey, I'm sure in Cyprus, because in our meetings we are discussing some important social problems for people with diabetes. Also, there are some important issues in people living in Cyprus. And in Turkey, I can talk about Turkey. In our country, we have this problem in some areas. So if people don't have health insurance, they cannot get access to insulin treatment also. This is very important barrier for insulin diabetes management, especially for kids. This cannot be accepted. Also in the other countries in the world, this is very important problem. Kids are dying because of absence of insulin, absence of access to insulin. You see, insulin is life actually. Insulin for life. Actually, I can say insulin is life. This is the picture of Leonard Thompson. She got first insulin injection after its discovery in the world. So this picture on the right side, just taken just after 2 months ago. So if he didn't get injection, he couldn't be survived. He could live more 12 years, but unfortunately after 12 years he was lost. He died because of pneumonia, but not because of diabetes. So insulin is life. Also, insulin brought a Nobel Prize to its discoverer. MacLeod and Banting got Nobel Physiology Prize for their discovery. Also, there are oral medications for the treatment of diabetes. Many people with diabetes need oral medicines to manage their conditions. And most people with diabetes are living in low and middle income countries. This is another reality. And for example, for Turkey, we don't have we don't achieve new medications, new oral medications quickly. So there is very important time delay. When a medicine, a new medication is launched, in Turkey, it is not achievable for a long time. It takes long time because of the price, also because of the legal issues, regulations, and some permission issues. So accessing to oral medications is a very important problem for many countries, including Turkey, including Cyprus, Northern Cyprus. And accessing to self-monitoring, patients, people with diabetes should measure their blood glucose in with different frequencies. For people using insulin, should measure 3 times, 4 times, even 8, 10 times in a day if it is needed. So for people with diabetes, taking only diet regulation even those people should measure their blood glucose. Also, there are new devices, continuous glucose monitoring systems, glucose sensors, they are called, and they are very new systems. It is measuring blood glucose for continuously for 10 a week, for 2 weeks, or continuously. So these are new devices, and these are very easy. They don't require finger prick, so it is less painful for people. Also, technology brings more benefits by using them. Especially for kids with type 1 diabetes, and for all people with diabetes, it brings freedom, and it brings regular glucose control, regular glucose measurements. But in Turkey, we cannot achieve it. They are not affordable because they are very expensive, and health insurance doesn't cover these new devices. For this year in Turkey, we announced to the politicians, to the government, to give to support these glucose measurement systems, CGM devices, freely, especially for kids with type 1 diabetes. And accessing to education and psychological support is important, but 1 in 2 people with diabetes do not have access to diabetes education program, unfortunately. All people with diabetes after diagnosis should get basic diabetes education. This is main rule in diabetes management, but this is not achievable for many people. Almost half of people with diabetes cannot get this training. Another issue, healthy eating and physical activity. Over 50% of type 2 diabetes can be prevented by these efforts, but we are not very successful on them. So these are the focusing points for next urgent strategies on diabetes, improvement of diabetes management. So we are waiting for regulations, new arrangements for improving these issues urgently. And let's look at diabetes nursing now briefly. Diabetes management, it requires multifactorial management or multifactorial strategies. So one person, one specialist cannot be sufficient to solve everything for patients. That's why diabetes management requires a team work. So diabetes team includes in the middle, people with diabetes, and also diabetes nurse, diabetes dietitian, and diabetes physician. Also, other team members could be included when person requires more support for other things, for example, eye exam or kidney problems, or pregnancy for women. Many other specialists should be included within this team when they are needed. And role of diabetes nurses, mainly in the secondary or tertiary prevention in Turkey, role of diabetes nurse focuses in this area, but actually primary prevention is very important, and diabetes nurse has a huge role in primary prevention and secondary prevention also. So diabetes nurse is also educator, and by educating people, primary prevention could be possible. And diabetes nurses should be acted in these areas in primary and secondary prevention. But in many places, actually, especially in low income and middle income countries, nurses, diabetes nurses, work in secondary unit instead of primary prevention, primary health settings. But in developed countries, high income countries, nurses, primary nurses or public health nurses are acting very much to treat people with diabetes at home. And also they are also working in primary prevention very intensely. Key role of diabetes nurse is to plan, implement, evaluate, and coordinate diabetes education. You see the roles of diabetes nurse. Education role is a major role, also caregiver role, especially for improving self-care of person. This role is important, but also diabetes nurse is a researcher. Diabetes nurse is a precursor for change. He or she is advocate for patient. And also diabetes nurse educates other healthcare professionals. Diabetes nurse should act in a political arena. And diabetes nurse is a coordinator. This is a teamwork. For each teamwork, a coordinator is essential actually. In many good diabetes teams, even they are named as coordinator, diabetes nurses are coordinated to this team. So in the background of this success, of their success, you can see the role of diabetes nurse as coordinating the team. And these are expanded role of diabetes nurse. Also, diabetes nurse can work at not only at hospitals, not only in the clinical area, diabetes centers, also in the at schools they can work, or in private hospitals, state hospitals, private doctor offices, university hospitals, family health centers. They can work, and if there are public health nurses or primary care nurses, they can go to home, workplaces, and schools to improve the management of people with diabetes in the settings. In Turkey, we have Diabetes Nursing Association. And you see our great teacher, Professor Sevgi Oktay. She is emeritus. She was retired long time ago, but she is very active in nursing now. You can see everywhere her name and her face, her voice, you can hear. And you see the list of co-founders. In 1995, Turkish Diabetes Nursing Association was established, and this association changed actually many things for diabetes nurses in Turkey. I was very active member. I am still active in the association, but for a long time I was executive committee member of the association. We did very much projects. After these slides, I will show you some activities from our Turkish Diabetes Nursing Association. Okay, this is another slide for diabetes, for explaining important Diabetes Nursing Association in Europe. This is Foundation of European Nurses in Diabetes. Its previous name was Federation of European Nurses in Diabetes. Now it is named as Foundation. And FAND was established at the same time, actually. in 1995 in Europe. And this foundation fund also changed huge important issues in Europe, even in the world, for diabetes nurses. It also affected our activities to be improved in Turkey too. We got very important support from fund during our first activities. For example, after earthquake, this organization fund gave some funds to our association, and we did a good project in the earthquake area for people with diabetes living there. So we have a very good relation with fund in Turkey. Turkish Diabetes Nurses Association has continuous relation with fund, and hopefully I believe in future also this relation will continue by improving, by being more effective also. So we have good basement on this. In Turkey, I'm sorry, I forgot again to change something here. Turkey in some milestones for diabetes nursing in Turkey are seen in the slide. So after Turkish Diabetes Nursing Association was established in 1995. Many actually, not some, many education programs were organized first for nurses, and then for other healthcare professionals, and for people, for public. But in 1999, first National Diabetes Nursing Symposia was organized by the association, DHD. And in 2002, first diabetes nursing certificate program was implemented. This was a milestone for diabetes nursing education in Turkey. This is scientific and academic training program. It was started with this aspect, and in 2014, Ministry of Health also accepted this program as a national program. National certificate programs were accepted by Ministry of Health by using our model, our certificate program strategies and rules. So almost a similar program was accepted by the ministry. Now, everywhere in Turkey, similar program could be organized for people having some resources, enough sufficient resources. So these are the milestones for Turkey about diabetes nursing. This is another aspect, actually, early studies, especially for the students. I would like to show these slides. When I am in the countries, I see in Turkey nursing education and also education for diabetes nurses improved in early term, earlier than many other countries. You see in the slide also same issue. In Turkey, these are preliminary early studies for diabetes nursing. Long time ago, actually in 1971, in Hacettepe University Nursing School, a nursing student in master program did a master thesis on diabetes. It was about diabetes education in group and individual settings. So this is very important subject for this term. During these years, this subject were not discussed very much. Actually, wasn't discussed very much. So from the first studies, I think this study. Also, second chair of our Diabetes Nursing Association, Professor Semra Erdoğan, did her PhD thesis in 1984 about diabetes for pediatric diabetes. And she did very interesting research study for her thesis. Actually, I admire for her subject. For those years, this subject was not very easy for work. She did implement video records for education. So she taught children and their family with diabetes by using video records. So this is very improved method actually for those years. If you check on High Education Council of Turkey, there is a thesis database. If you use this database, you can search and you can find those theses. Please read them if you have Turkish. So these are early studies, and we can trust ourselves, our background, our models in the past was very good actually. So we are lucky for having those professors and by taking teaching from them. So this is very nice pictures they just draw actually. During these years there was no resources for printing like now. They just draw for children. You see how they taught, how they educated, how she educated the children for her research. So what I did now, I would like to give some examples about diabetes nursing by using my adventure, my journey, some details from my journey in diabetes nursing. So as a diabetes nurse, I can tell you, you can follow similar steps or other steps better than those examples. So a diabetes nurse can work nationally, internationally, as a clinician, as an academician, and as a volunteer for public efforts. So this is my brief background. I graduated from Florence Nightingale School of Nursing of Istanbul University in 1991. And I completed my master degree and PhD degree in the same university with the thesis regarding diabetes management, diabetes education. So these are my theses. Also, if you are interested, you can find on the Library of High Education Council on the website. You can find them. At the same time, after graduation, when I was doing my master, I also worked in the hospital as a staff nurse in an endocrine unit of Cerrahpaşa University Hospital about 4 years. After that, I started to work in the school, Florence Nightingale School of Nursing, as research assistant, then assistant professor, then associate professor. Almost 20 years I worked there, and then I started to work at Koç University School of Nursing. It is almost 8 years, actually. 8 years past. I am within 9 years, 90 years now. So time is flying. So I am working now at Koç University School of Nursing. But 2 years ago, I was directing the hospitals of Vehbi Koç Foundation, which are Koç University Hospital and American Hospital. So I was a chief nursing officer on those in these hospitals. It was also a very important experience for me. I saw from the other side, from management side, the nursing issues. It was very important experience for me. And also, these are official sites, training, and also professional job you saw till now. But at the same time, I did start with some volunteer works, volunteer things. When I was working at the night shift in Cerrahpaşa Hospital in endocrine unit, also I was doing my master training. At the same time, I was volunteer to learn about diabetic food in a leprosy hospital in Istanbul. A professor who is a great professor, Professor Ayşe Yüksel, taught me actually about neuropathic food and diabetic food. I am thankful to her, and she was very patient to teach me almost a year. Our aim was to open a diabetic food clinic in Cerrahpaşa University Hospital as a team with a professor who is leading in the endocrine unit. So almost more than 1 year we worked, but then because of financial limitations, because lack of financial resources, we couldn't open this food unit. But our continuous relation still going on with Professor Ayşe Yüksel. She is very active now. You can see everywhere her name. She is also very much has very much volunteer work in Çağdaş Yaşamı Destekleme Derneği, which is an association in Turkey working for increasing modern lifestyle, modern education, improving education opportunities, especially for girls, for students, and for many people, for public. So also in 1999, I started my diabetes nursing certificate program in Surrey University, which was a program organized by Federation of European Nurses in Diabetes. But it is a university program, academic program, and we got 30 ECTS credits by completing this program. It continued almost 1.5 years on-site and online education. They did actually during that time. And we got very important networking opportunity by joining this program. I completed the program also. I had a very important connection, very important network within FANT by attending this program. And other trainings which I got or I could complete from, for example, American Diabetes Association. It is a advanced postgraduate diabetes course, or other one, diabetes certificate program, Diabetes Manager University in Arizona, or another one. It's from IDF Europe, International Diabetes Federation, Europe section, training of expert trainers certificate. Actually, there are many other education opportunities which I could catch from beginning till now. So there are lots of things around of us. So within our career planning, we have to open our eyes, and we have to choose which is convenient for our aim, for our future plans. Those programs and others trained me well for diabetes nursing in clinical and academic perspectives. Also, they increased my networking opportunities. So this is another important aspect for joining them. Other programs I was enrolled are seen here. European Trained Food Trainer Certificate Program, systematic review course, for example. This is to increase the capability as a researcher, which is an important program. Actually, it was a good one. Another one from American Science Academy, educational responsible science. This was about ethics and research. Another program is smoking cessation. So we are organizing a smoking cessation program for people with diabetes and for diabetes nurses. And this was a training program to train ourselves about smoking cessation. Organized by professors from Arizona University. Then our relation continued, and I joined their smoking cessation project with a leading friend who is psychologist here in Turkey. So these are some important parts actually from my background. And United States was the first influence for me, and to understand what I can do more in future. So I applied to New York University College of Nursing or School of Nursing. It was in 2004, and they accepted me, but I had a very good reference from Caroline Robertson, who I am very much thankful. And they accepted my application, and I stayed there. In nursing school, I stayed about 3 months, and within this term, I could join all activities of nursing school, all academic activities. I could enroll to some program, master programs, master courses, or bachelor courses, PhD courses. So I could observe what are they doing, what they are doing, and also I could join some research project. And then after 3 months, also I became a research scholar at New York University Hospital as officially. I could see many important diabetes centers during 1.5 years in New York, during my adventure in New York. And for example, Downstate Medical Center was my first experience in endocrine unit of a US hospital. So then I continued in diabetes clinic of Mount Sinai Hospital of New York University. So around a year clinical experience I got. So it was very important. I still remember and use as examples the patients who I saw during this time. For example, I met a person in Columbia University who was diagnosed by Dr. Jocelyn, who was a doctor using first insulin treatment in the world. So these were nice experiences in my career, and they fed me very much for future. Also, at the same time, I was volunteer to see more in New York, and they accepted me as observer in Columbia University Wound Healing Center. So I could see important diabetic foot ulcers and their treatment methods I could observe during this stage, during this term. Yes, other experiences were possible also. I could catch a chance to go to Michigan University, Michigan Diabetes Research and Training Center at the same time. So when I was there more than a year, I could go everywhere in United States to other states, to the other states I could go, and I could have some experiences. For example, a patient school, diabetes school for patients. I could attend a week in New York State in the other hospital. At the same time, it's not written here actually, you will see a picture. For example, I went to Arizona, I went to Kansas, and I stayed about 2 weeks in a clinic, which is the first 10 best diabetes clinics, diabetes centers of US during that time. So it gave me very important experiences. It is here actually. Observer Mid America Diabetes Associates, Wichita, Kansas. So it was a very important experience for me. And I was invited as guest researcher in Sweden, in Uppsala University. I worked about 2 weeks or 20 days. Actually, the biggest one was the invitation from King's College of London. They invited me as a fellow, as a clinical research fellow. By this invitation, I could stay there almost 9 months. I could stay actually 2 years, but I couldn't maintain this term from my university. It wasn't easy during that time, so I could only stay 9 months. Then I went intervally within 2 years, and I completed my project. So I stayed there. I had a nice apartment in London, in the heart of London. I could work in King's College London, Florence Nightingale School of Nursing, which was established by Florence Nightingale as a first school of nursing of UK. And this is a very good experience also. And also at the same time, I joined to the hospital, King's College Hospital. There is a nice intensive insulin clinic in diabetes center. I attended to this clinic, and I did a project in this clinic to improve the clinical services there. After our project, I was leading this project, but I did this project with whole team. So this was a nice one. So whole team of the clinic supported me, and we worked together. After this project, they said for a long time they were still using the results of the project. So this was a good result for my effort, because now translational projects are preferred. Just before finishing the project, they started to change something in the clinical service. So that's why I am very pleased to be involved in this process in King's College in London. Okay. I was also invited as a jury member for tenure position in McMaster University in Canada, for example. So I put some pictures to you. This is from New York. She is very good diabetes nurse, Caroline Robertson. She was working in diabetes center in New York University, and she was my advisor there. She supports hugely to me. She supported very much. And Professor Andrew Drexler, she also was my official advisor during my stay. So I am thankful to them. He passed away 2 years ago, and 2 days ago was his anniversary. So I am remembering him with our good memories, with our those pictures. So our continuous relation are seen in these pictures. Caroline, her husband Walt, and together all of us here in Canada, for example. So this is from the same year in 2005. So these are first experiences for me actually in international area. That's why they are still alive memories for me. This is Mid Diabetes Associates in Kansas. They have really very good clinic, and Dr. Richard Guthrie, professor in pediatric diabetes, and they are a couple. Her wife is Professor Diana Guthrie. She is a nurse, emeritus. She was emeritus nurse, professor, and I stayed with them. They hospitalized me at their home actually. So this was very unique time also in my life. So I remember then with very good memories by smiling with a big smile on my face when I think of those memories. I think, big smile on my face. So also they were really good, doing very good. This is very interesting picture, maybe not very meaningful for you, but there is a nice story in it. This is they are carrying some devices to open a day clinic in an area 4 hours away from Wichita, from their centers, their city. They were traveling for 4 hours by car. Then they opened a day clinic in a small village. So there was no hospital in this village because people living in this village were Mormon groups, and in their belief, they were not going to the hospitals. So these diabetes team were treating them. This team treated them very well within a day. So they were going once in a month regularly to this village to treat whole people living in the village. So I joined them. I traveled with them, and we opened together this clinic during that day. In the morning, in early morning, we organized. We put all devices, laboratory resources, and other things also. Doctors, nurses, dietitians, even psychologists and laboratorian. So a nice clinic was opened within 30 minutes. Then we worked very hard during the day. In the end of day, we examined, we checked many people, over 100, almost 200 people maybe within a day. So it was huge volunteer work. I learned very much from their effort. So this is the family. This is from King's College of London. Very nice diabetes nurse. She is a senior nurse, senior diabetes nurse, Helen Rogers, and she is a nurse prescriber. This is the team of intensive insulin clinic. Professor Stephanie Amiel is here, and other Professor Pratik Chaudhry, and me, and psychologist, and yes, her, and my actually student, ex-student. They are my students, but Öznur was living in London, and she joined to my project. We worked together in King's College Hospital. And Emine also came after me to the Diabetic Food Center. So we were together for a week maybe together. So this is the School of Nursing and Midwifery, Florence Nightingale School of Nursing and Midwifery of King's College London. So this is my final day. So I am packing, and I am almost leaving London after 9 months. So Öznur and I were working very hard on Saturdays, even on Saturdays in the clinic on patients' data. So also I regularly was buying some fresh milk. She is the man, so selling the milk, fresh milk from the cows, my market near my home. Uppsala University, in my office, professor inviting me and another professor, we worked together. We were discussing on a project actually during that time when this picture was taken. So in my office there, and in the class, PhD graduate class, I was giving a lecture to the students in Uppsala University. So what a diabetes nurse can do to train herself and to learn more and to disseminate the knowledge to the others. I am explaining my background to give some examples to you for those strategies or for those routes. Also, from 1996 till now, I am member of Diabetes Nursing Association, and till 2011, till I went to London, I was executive committee member of the association, and I was general secretary. We did very we did work hard actually, but by feeling happy in the association, this is important. So also I am the member of Turkish Diabetes Foundation. In the past also around 2000, between 2000 2005, we worked very intensely for some projects in Turkish Diabetes Foundation. Actually, I was active in Federation, Foundation of European Nurses in Diabetes. My relation started with NCAP course, Diabetes Nurse Certificate Program. But after that, we continued our network, and I was elected as an executive committee member of FAND in 2003, almost 3 terms. I was elected again, and till 2008 I continued my 2 terms. Then they invited me as special advisor, but also in 2014 I was elected again as my last term, and I worked in the committee, in the executive committee of FAND. During this time, for a long time actually, I joined to the FAND annual congresses as the member of organizing committee and scientific committee. So we did European Diabetes Nursing Congress every year. So my last duty, I think, was 2 years ago. So still, I am joining. I am a member. And pandemic did give us some breaks, but hopefully in future we could do more things in Europe, in also in the other countries. Another important experience in International Diabetes Federation, I was invited as a member to the Diabetes Education Consultative section of this federation. So this section, DEX, was a very active committee. We did work very much actually, really, at nights, during the days and almost nights. We worked on-site and online works. We did a lot. And at the same time, we did work on recognition of diabetes centers around the world, for example. During this term, I could learn a lot about diabetes, diabetes nursing around the world, not only in Europe, because many applications we got and we discussed. Also, I could meet many people from all continents. So those memberships and those works were volunteer works, but they gave very important experiences about global arena. Besides DEX committee, also I was invited to insulin and other medicines task force of IDF. For example, we worked there for some efforts of Insulin for Life for children, donations, and other things. So this was another group within IDF which I worked. And International Diabetes Federation organized World Diabetes Congresses. As a diabetes nurse, I can tell you by feeling happy, by good feelings actually. I was invited to a symposia as a first time. We did a project in Turkey about insulin treatment. It was a national insulin education program for nurses. We educated around 10,000 nurses in Turkey within this project. And it was a project we did together with IDF, Ministry of Health, and Diabetes Nursing Association. So IDF showed this project as a good project, and they invited me to present the result of this project in a World Diabetes Congress. So within this Congress, I was only one Turkish person presenting orally in a symposium as invited speaker. So as a nurse, this is, I think, important results for diabetes nursing in Turkey. And also, I worked in the organization and scientific committees of World Diabetes Congresses 3 times in Dubai, Melbourne, and Vancouver. So I was involved in the organizing committee. And there was another group. This brought important experience about Turkish immigrants living in European countries, especially in Germany. German Diabetes Association invited us as a Turkish team to work together to solve some problems for Turkish people with diabetes living in Germany. So it's a subcommittee within. It was a subcommittee within German Diabetes Association. For several years, we worked together. I was involved in this committee as a representative of nurses, as a Turkish diabetes nurse. I joined. There was physician, there was dietitian. So as a diabetes team, actually, we were there. Turkish Diabetes Foundation led this project, and that's how I was there together with this group. So we did something for solving people who are immigrant related to their management, diabetes management. Another group, Diabetes Asia Study Group, for a few years actually. I was member of this group, and Diabetes Education Study Group, another one. I was involved, and also still I am a member of the Food International Working Group for Diabetic Food. Actually, there are lots of things to do within this group, but there was no time. It is a shame for me, but hopefully in future we can do more to improve those activities by relation with this group in Turkey. So some pictures from IDF committee, multinational actually, from US, from Canada, from again US, from South America, and me. So similar group from also China, our friend. So from different countries, we did have many meetings in many different countries, many different continents. This was in Singapore. We went to Hong Kong, we went to Norway and other countries also. So this is a picture from WHO, World Health Organization. There was a project for peer education in diabetes. It was a meeting organized by the World Health Organization and International Diabetes Federation. Also, I joined to this meeting as a diabetes nurse. She is Mark McGill from Australia. This lady is from, I think, I'm not sure the other people, but from Canada, Miss Anne Belton, very good also diabetes nurse. So they are diabetes nurses, diabetes physicians, and other professionals. This meeting was held in the main building of World Health Organization in Switzerland, in Geneva. So we were there. We were in the main building of WHO in Geneva for a week. So it was very interesting experience again for me. So this was a reception in the end of day. So this is from a keynote speech in FAND meeting, the European Diabetes Nursing meeting, and also we were chairing together. She is co-founder of FAND, Ms. Deidre Cregan. She is the diabetes nurse for a long time. and we were chairing in the FANT meeting together. This is from the World Diabetes Congress. I was invited speaker there, and I was giving my speech during that time. This is from International Working Group on Diabetic Food, our training for a week. My teacher from Leprosy Hospital, Professor Ayşe Yüksel, and she is from King College Hospital, podiatrician, and we were presenting something also during the meeting. This is from the German subcommittee, Turkish-German immigrant people's Turkish-German subcommittee in German Diabetes Association to help immigrant people with diabetes from Turkey. And another European Nurses Symposium in Vienna. I was speaking during that time. And after my speech, Turkish group is here. And another European nurses meeting in, I think, Germany, Cologne. So in the end of meeting, our Turkish group is here. Finally, last year, they were awarded me with recognition award. FANT recognition award was given. This is honor, very important, great honor for me to be involved in the list within this recognition. It was given in recognition of distinguished service in diabetes care, research, and education. In the end of all long days, long weeks, years, actually, this rest me, this rest my feelings, my tiredness, and very positive route opened in front of me with this award. My enthusiasm increased actually. So it motivated me, and hopefully in future we can do again better, improved things for diabetes nursing, for people with diabetes, for public, for our generation, our world. So awards motivates me. I understand this. And another award, this award was published in the newspapers last year, actually. In many media, it was announced. So I was encouraged by this news. Thank you for all. And another important award in my life till now came from Professor Dr. Perihan Velioğlu. Professor Dr. Perihan Velioğlu is our leading teacher, founder of our school, Florence Nightingale School of Nurses, School of Nursing, and also she is a leading. She was a leading professor in Turkey for nursing, not only diabetes nursing, for nursing. And Professor Dr. Sevgi Oktay, she is my teacher. And I learned a lot from her. Still, I am learning from her. Even she is emeritus, she is very active, and she is teaching to us with all phone calls, with all meetings. And they gave me this honor award. And this was also great honor for me. Before this, also from Professor Dr. Perihan Velioğlu Nursing Foundation, long time ago, in the beginning of my career in 1999, they were awarded me with an encouragement award. Now they gave me honor award. So a line was completed. I feel this. And a service award from Turkish Diabetes Foundation after our project in the southeastern area region of Turkey. We worked around for 5 years for improving diabetes management in this area. So Turkish Diabetes Foundation awarded us after this project. Another also award came, and this is our chair, current chair of Turkish Diabetes Nursing Association, Professor Nermin Olgun, and my also good friend from the association, from school and from life, Gülhan Coşanslı. She is also academician, assistant professor. We were together in European Diabetes Congress. We were presenting our joint project there. From smoking cessation program, my friend who is a very important psychologist in Kadir Has University, and first her friends then became our friends. Professor Nichters from Arizona University, they are anthropologists, psychologists, all multi-professional groups. We are Turkish group here, and so they led us, and we are still doing a smoking cessation program with them. So from our program, we are together. We taught other nurses also. After they trained us, we trained the other nurses. So this is nice picture from our Turkish Diabetes Nursing Symposia, 9th Symposia. This is some time ago. So we did 25th Symposia this year, I think. So long time ago, but Fant Chair and Mary Felton and Caroline Robertson. So international participation speakers actually are here, Professor Sevgi Oktay, Professor Ayşe Yüksel. That's why I put here Professor Semra Erdoğan and Professor Nermin Olgun and Professor Hülya Okumuş from İzmir. Actually, I apologize if I couldn't see from here, but very nice group leading people for diabetes nursing are within this picture. After a project in Ministry of Health, I think we completed Turkish National Diabetes Patient Education Curriculum within this group, and it was disseminated after this picture. I think it was printed and disseminated. So this is a group picture regarding this project with my students in Turkey, another speech, and our 13th anniversary of graduation at Florence Nightingale School of Nursing, my friends from the undergraduate program. And my students in Koç University, still my PhD student from the undergraduate till graduate level, and in our association we work together also. So she is very nice diabetes nurse Feride, and she was presenting her master thesis in European Diabetes Nursing Congress. So this was her first research, her master thesis also, and she presented her first research in an international congress. So this is good achievement for her. So we were celebrating this with picture. And this is from Koç University, Semahat Arsel Nursing Education and Research Center, our diabetes nursing certificate program attendees, and Professor Nermin Olgun, our chairman, and many Professor Sevgi Oktay is here. You see, we have really good environment in the certificate programs, and we were learning together. We were enjoying together. So we usually have very nice atmosphere during these programs. It is a month program, whole month it continues. So 20 working days from morning till night till evening. So actually they are tired, but they are still smiling. It is good sign for our program. During my directorship at the hospital, picture with nurse managers in hospital. Long time ago, in I think 2006, after I returned from US, Professor Sevgi Oktay was saying something, and Professor Nermin Olgun was doing something in this picture. I like this picture, that's why I put here good memories. So other pictures actually. I don't wanna make very long presentation now, but all are from Turkish diabetes nurses activities you see from our symposia, from our group teaching programs, during meeting, during a break, possibly some sightseeing, but hard works you see here. Again, Anne-Marie Felton, fan chair, Caroline Robertson, our Congress chair, Mustafa Kutlu, and many people faces are here and here. So you see, we are in Turkish Diabetes Nursing Association. Nurses are awarded also for their services in 10th year. This lady was taking her award for 10th year service. This picture was taken in Cyprus. There was a meeting in Cyprus a few years ago, Turkey National Diabetes Congress. Also, we did organize nursing symposia. And at night, President of Prime Minister of Cyprus invited us to his home for a dinner. So after the dinner, this picture was taken. And if you need any more information about diabetes nursing, there is a chapter within it, which is a new one, just published in August this year. And if you need more also resource in Turkish, not in English, unfortunately, but for Turkish, you can find this resource. So I recommend for more. And I would like to finalize my talk with those messages. Not very much scientific maybe, but science is in our minds and skills. But these beliefs, these thoughts are important. These are triggering or motivational factors. They are rooting us on our ways. Just believe and then work, work, work, work, work, work. There's no other way. Then don't lose your humanity and enthusiasm. There are lots of things to do, but when you do something, we shouldn't lose our humanity and our enthusiasm. Then we can enjoy by working. And please know the value of good deeds. This is important for life. And another thing, don't close your eyes when you see the wrong. Unfortunately, there are lots of things which is not correct around of us. So we shouldn't close our eyes for everywhere in professional life too. And if everyone cleans the front of their house, the whole street, city, country will be cleaned. I like this statement. And also, when we do this by starting from ourselves, I think many problems in public, in our countries, in our work or school environments, everywhere, all will be solved. So this is important. And especially for studentships, for this term, I have very strong belief, my principle. I learned from my family. Don't cheat. They were telling me all the time, don't cheat. Cheating is theft. So I learned this from my family. And if this principle is not accepted in our minds, this can be converted to the, for example, plagiarism in future when you write something, or with different behaviors. It can this behavior can continue. So this is important. All are my beliefs and um, my supporting thoughts to do something in the past and for future. Thank you for listening to me, and teşekkür ederim. I would like to say in Turkish, and thank you very much. So
Thank you very much.
yes,
Thank you very
this
much,
is
dear
very
Professor Özcan. It was really amazing, informative, useful presentation. From my side, I can tell you that I learned a lot of some new things. I did not know about the blue circle, for example, and this blue color for Galata Tower. It was really interesting. It was amazing photo by the obese animals. They're really, they're really nice. Thank you very much. A lot of good, useful information. I'm sure that all of people who watch that, who will watch these presentations, really will learn a lot. Thank you very much. Now I would like to invite Professor Dr. Firdevs Erdemir. Yes, I think the professor, she wants also to make some little speech. You're welcome, Professor Firdevs.
Thank you, Anna. Thank you very much for sharing such inspiring experience, knowledge, and understanding of nursing with us, Professor Shaida Osjan. Really, I was very impressed with your conference. I remember I met you at a congress about 15 years ago. Actually, I was very impressed by the way you represented the profession, your collaboration skills with other organizations. I observed you as a general secretary of, I think, your positions like that, general secretary of Turkish Diabetic Association at that times. I was a member of Turkish Nursing Association. I impressed at that time, and really today I excited very much with your speaking. Now I'm very happy to opportunity to introduce you to our students. And we have students at various stage of nursing education are with us now. That's why I would also like to thank you for your suggestion and keywords you shared at the end of your speaking. I think these are very important, and I thank for that as well. These were very valuable, I think. Once again, thank you very much for your sharing, your experience, your knowledge with us, also for your time. I know you have a very busy program. Thanks a lot.
Thank you very much for giving me this opportunity and such a nice words about me. I remember very much first when we met in our symposia. I remember like today, actually. We were sitting in the front, and it was a nice time to be with us. We were also grateful with your participation. Hopefully, without being again long time, we can meet again face to face, and we can do something. Thank you very much for inviting me give this chance to talk to your students and to the public actually. So hopefully we can share something again regarding nursing, regarding diabetes nursing. This is my honor to be here. Thank you very much.
You're welcome.
Thank you very much, dear professor. Thank you very much, Professor Firdevs. Thank you very much, Professor Shaida Osjan. I think, yes, we will hopefully to meet you again. Thank you very much for the meeting for today. And we would like to say goodbye to everyone.
Okay, goodbye.
Thank you.
catching a bus. Never